Let's continue on with the female reproductive system. So the histology, or the tissue appearance of the uterus. Inside we have the endometrium, and the endometrium is going to support the developing embryo, the developing fetus. And there are two regions. There's the functional zone, and this is where the tissue builds up to support the embryo, and this is the part that is shed monthly during menstruation. And then there's the basilar zone, or basilar zone. I usually call it basilar. And this is the layer of tissue that grows to generate the functional zone. So the basilar zone is basically the stem cells producing the functional zone, and the functional zone is what's shed off. The myometrium is the smooth muscle. It has circular and longitudinal and oblique layers, and the myometrium is what contracts to push the baby out during birth. But the myometrium is also what contracts during menstruation, which produces the characteristic cramping sensation of the uterus during menses. And then there's the perimetrium, which can also be called the tunica serosa. And this covers the fundus and attaches the uterus to the posterior uterine surface. And so there are two pouches formed by this outer surface. We have the recto-uterine pouch between the uterus and the rectum, and then the I have a hard time with this one too. The Secretory pouch, which is between the urinary bladder and the uterus. So if we come over here, you can see it better over here. Here's the uterine wall. So here's an artery that's going to be supplying the the endometrium with blood and nutrients and removing waste. This is the myometrium, and so you can see that there's some longitudinal, some circular muscle here, and again, this is going to be important for childbirth. The uterine glands, which are going to be producing different compounds, usually progesterone. The uterine cavity right over here. The spiral artery is just kind of it's named the spiral artery because it looks like it's a little spiral. The arcuate arteries, the radial artery, and then here's the uterine artery, the large artery that feeds the uterus, and here's a part of the uterine artery right here on the left side that feeds blood to the uterus. And so the endometrium has its simpler columnar epithelium inside the uterine cavity. Then you have the endometrial glands. These glands are going to be producing different compounds, okay? And then you have the functional zone, and this functional zone, this whole region here, including the glands, is going to be shed during menses. The basilar zone, this region right here, is where new tissue is going to be produced. Here, I'll just kind of scratch in where the functional zone is. The functional zone is going to be producing the functional zone. All right, so these cells will divide and generate the functional zone on a monthly cycle until menopause hits. And then the myometrium is the muscle. So when we're looking at the anatomy of the female reproductive system, it's always very tempting to think about just this region right here, the functional zone, but there's a whole lot of other regions that are essential for supporting the developing fetus. So the uterine cycle itself averages about 28 days in females, in menstruating females. It can range from 21 all the way out to 35 days in normal individuals. The phases are going to occur based on hormonal cycling, so based on hormones associated with the ovarian cycle. So there are three phases of the uterine or the menstrual cycle. There's the menses, which is phase 1. So this is the initiation of shedding of that functional zone. So that's when blood first appears. There's the proliferative phase. That's when the new functional zone is being made and is starting to grow and develop, and new blood vessels are growing into the new functional zone. And then there's the secretory phase, where the endometrial glands grow and begin secreting. And so the endometrial glands were, if we go back 2 slides, these regions right here, the endometrial glands. So they're always regrowing every month. So menarche is the age at which the menstrual cycle begins in females, and menopause is the last menstrual cycle. And so a lot of times people talk about menopause as, a period of time in a woman's life, and it is, but menopause is defined as not having a menstrual cycle for 1 year. All right. So if a woman stops menstruating and then 8 months later she has a menstrual cycle, well, then menopause has not occurred. Usually preceding menopause is a period of time where menstrual cycles become kind of irregular. You might skip a month or two, and then you skip 3 months, 4 months, then 6 months, and it's different for every woman, but that's called perimenopause. And perimenopause is a period of time during which these 3 phases are not occurring consistently. So what hormones are regulating the uterine cycle? Follicle-stimulating hormone, FSH, which is made in the pituitary, stimulates the follicles to develop. All right. Luteinizing hormone, LH, stimulates the actual ovulation event itself. There are estrogens. There are a couple different types. Estrogens are really important for bone and muscle growth. And during menarche, when menses first comes on in females, estrogens actually close the growth plates in bone. So usually after a young woman has started her menstrual cycle fairly consistently, she's done growing, at least height-wise. Estrogen does affect muscle growth, not as profoundly as testosterone does in males, though. Estrogens help maintain our secondary sexual characteristics, the development of mammary tissue and so forth. It definitely affects the function of the central nervous system, including sex drive, affecting behaviors, affecting memory and attitudes towards the world. Estrogen helps maintain reproductive glands and organs. It does help initiate the repair and growth of uterine lining. So after menses occurs, the estrogen that's secreted by ovaries helps trigger that functional zone to repair itself. Now, one of the things that you might hear about in physiology is the effect of estrogens on people's attitudes and the appearance or not appearance, I guess you could say, of anxiety during menstrual cycle. So it used to be a joke, PMS used to be considered a joke, but now it's not, because we understand that estrogens, cycling levels of estrogens and progesterone definitely affect people's attitudes and behaviors above and beyond sex drive. So if anybody is having issues with anxiety, stress, anger, and so forth, approaching the second half of their estrous cycle, or the second half of their luteal cycle, oftentimes it has to do with the drop in estrogen and the increase in progesterone. Progesterone is going to stimulate the uterus to prepare for pregnancy. So what's going to happen is over the month, estrogen goes up and then drops, all right? Progesterone will then go up and then drop. I would do progesterone in a different color. It'll just take me too much time, okay? Progesterone. And then this is estrogen. Okay? And so usually it's this region right here where women have PMS-type symptoms, and they can extend all the way to the end of the progesterone cycle where menses is initiated. Relaxin is an interesting hormone. Relaxin actually increases the flexibility of the pelvis. It causes cervical dilation during childbirth, but relaxin also allows ligaments and connective tissue to kind of, relax so that childbirth can occur. It allows the distension of the suspensory ligaments so that the uterus can expand. And then there's oxytocin, which actually stimulates uterine contractions for childbirth, and you'll hear a whole lot more about that in physiology. So here's an example. Here is the estrogen. Here is the progesterone peak, and then here's inhibin. Don't worry about inhibin for now. But you can see here that follicle-stimulating hormone, as that goes down slightly, you'll see a maturation of the follicle. There's a slight peak. Luteinizing hormone causes ovulation, and then the corpus luteum and formation starts from the leftover bit of the follicle, and that's going to be transitioning to the mature corpus luteum, and then the corpus albicans, which is going to be producing other hormones. Here's the ovarian hormone cycle, and then you can see what happens with the endometrial changes. So during menses right here, you see the destruction of the functional zone, shedding of the functional zone. During the proliferative phase, while or I guess you would say preceding ovulation, you'll see the repair and regeneration of the functional zone. And then you'll see the secretion of endometrial glands into the uterus. So you'll see the secretion of different compounds, different hormones during the secondary phase. So now the outer portion of the female reproductive system, the vagina, is basically a big muscular tube from the cervix to the exterior of the body, very, very stretchy, has to be stretchy to accommodate the delivery of offspring or of a baby. And so it's the passageway for menstrual fluid in addition to the birth canal, and it also receives the penis during copulation, and it's a spot where sperm is deposited. So the vaginal canal itself is the cavity within the vagina. The fornix is the pocket around the cervix, and the hymen is a piece of epithelial tissue that partially covers the vaginal orifice in younger women. So the vagina itself has histology. It has a tunica mucosa. It's a non-keratinized squamous epithelial layer, lots of rugae, lots of connective tissue, lamina propria connective tissue underlying those epithelial cells. There's a tunica muscularis. It has circular and longitudinal muscles. And then there's tunica serosa or a tunica adventiva near the uterus itself. And the serosa layer is continuous with the pelvic peritoneum. So that's the connection. And it's mostly covered by, the tunica serosa is mostly covered by adventiva, which means lots and lots of fibrous connective tissue. So here's the lumen of the vaginal canal right here. Remember, lumen means kind of the tube, right? Here's our stratified non-squamous or stratified squamous epithelium. It's non-cornified. In other words, it's not very hard, right? It's not like thick, super thick tissue. Bundles of smooth muscle fibers, lots of blood vessels, and lamina propria. So, what lives in the vagina? There is an ecosystem in there, believe it or not, and there's a population of resident bacteria and fungi that helps support cervical mucus, which is supported by cervical mucus. It's given these organisms are given nutrients by the cervical mucus, and basically, what's the point of the fungi and the bacteria there? These are your probiotics that help restrict the growth of other pathogens that might get into the vaginal opening. And so if you think about it, swimming in a lake, swimming in a river, other pathogens like protists or other fungi or bacteria might be able to enter the vaginal canal. Well, lucky for us, those resident bacteria help keep us healthy and safe from that. It also helps regulate the acidity to inhibit sperm motility, but I thought we wanted fertilization to happen. Well, fertilization is a big deal, but reducing the number of sperm and changing motility is one way to sort out the strongest, healthiest sperm to give rise to the best offspring that you could possibly have, right? It's a kind of a natural selection environment. The seminal fluid from males help buffer and counteract this. So the seminal fluid is battling the acidity of the vaginal ecosystem, and the deposition of semen itself close to the cervix minimizes the time spent in this acidic canal. So it turns out that the ecosystem inside of the vaginal canal can be thrown off when people take antibiotics. Antibiotics will allow for vaginal yeast to proliferate, Candida, and that leads to yeast infections. So in some women who take systemic antibiotic medication for sinus infections or anything else, sometimes they are subject to vaginal yeast infections. We will continue on with the last part of the female reproductive system in the next part of this lecture.